Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the Goldberg Depression Assessment. What is a Goldberg Depression Test or assessment? The Goldberg Depression Test is one of many depression scales that mental health care professionals can use to assess the severity of depression symptoms in their patients. Depression tests are not used to diagnose depression, but they are there to help the diagnostic process, which could also include physical exams like blood tests, CT scans or MRI, electrocardiogram, and/or electroencephalogram. A depression test or scale usually comes in the form of a questionnaire, which is the case here. Sometimes they are answered with a simple yes or no, while some are answered with ratings from 0 or 1 to a certain number, which is typically the Goldberg Depression Test. All depression scales have score ranges, and each range has a specific designation that represents a severity level for depression. This is listed on the sheet. Using the results of the test, mental health care professionals can evaluate next treatment steps, which may include medication. As a result, it is commonly used by counsellors, therapists, psychologists, and more. Here's how to use a Goldberg Depression Test. The first step is to fill in the patient information and complete the questionnaire with your patient, or distribute the sheet for your patient to complete. Complete the scores at the bottom and translate results to get a depression score. You can also add in additional notes for further treatment steps and plans. To view a sample assessment of the Goldberg Depression Test, feel free to visit carepatron.com where you can download and access the test for free. You can also access the test through the Carepatron platform. Simply filter by community and assessment and type in the keywords to find the note. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos.